In this presentation, I'm going to talk about our paper, Diversity-Aware Anonymization for Structured Health Data. First, I will talk about the problem. So we have data owners, or in our scenario, patients, which their data is collected by hospital and held there. Then in the hospital, we want to share the data with another party called data recipient, or in our scenario, it can be a research center. But sharing the data in its raw format can reveal sensitive information about patients. So we need to use privacy preserving data publishing techniques. Even after removing the identifier fields, the sharing the raw data can violate the privacy of the patient. So we need to consider attack models. Here in this study, we consider record linkage and attribute linkage attack models, which I'm going to talk about in the following slides. And we address the problem for structured data, which can be stored in spreadsheets. So in anonymization, we alter the data in order to make it hard or impossible for the adversary to re-identify data owners or patients. And we always have a trade-off between data utility and privacy and anonymization, because after perturbing the data, we improve the privacy, but that can degrade the data utility. And in anonymization method, we need to consider one or more attack models, and we have several. We have one or more privacy models addressing those attack models, and we need to consider them in our anonymization methods. The first attack was record linkage attack. Even this is an example of data after removing the identifier fields, but we suppose in anonymization that we have a set of attributes in our data called quasi-identifier attributes that we suppose that the adversary knows about these attributes for the victim patient. Here, age, number of children, and smoke are quasi-identifiers. And in the data, we also have a sensitive attribute, and we can have one or more attributes that are not sensitive and are not important for us. So if in this data, if the adversary knows that the victim patient is 37 years old and has 2 children and smokes, he or she can map his or her information to record number 1. And so the adversary can identify that the victim patient was diagnosed with HIV. So this is a record linkage attack model. But K-anonymity privacy model tries to address this. K-anonymity tries to share a version of data that information that each record is not distinguishable from K-1 other records. For instance, in the previous example, the adversary can only map his or her information to 3 records. So here, this table is a 3 anonymous table. But the problem is that if the diversity of values in the sensitive attribute for that QID group is low, like here in our example, the adversary can infer with high confidence about the value of sensitive attribute. Here, he or she can identify that the patient was diagnosed with HIV with 100% confidence. For addressing this, we have L diversity and its variance, entropy L diversity and CL diversity privacy models, and T closeness, which address the problem of diversity in the sensitive, diversity of values in the sensitive attribute. Now we consider these privacy models and attack models and try to propose a solution. We start with an example here. Suppose that we have 10 samples, 2 among them have sensitive values. I mean, for instance, in our example, 2 of the patients are diagnosed with HIV. And if we just consider the K anonymity and cluster the data based on that to make the QID groups, the clustering result would be like this, but this is not desirable for us because the number of, the records with sensitive value are in one QID group, and the adversary can infer with more confidence that the victim patient was diagnosed with HIV, for example, here. And we introduce a constraint in our solution in order to change the clustering result and to change the result for making the QID groups. We try to distribute these records with sensitive value to the available QID groups that we have. So this is our idea, and in this way we not only try to consider the K anonymity, we also consider the diversity, which was a concern in L diversity and T closeness privacy models. So we use the constraint programming for finding the QID groups and clustering. This is like a simple clustering with constraint programming. We want to minimize the distance between the samples in one QID group or one cluster with this term. We also introduced a constraint in this programming problem that tries to distribute the records with sensitive value into all QIDs evenly. So this is our solution. And for evaluation, we used heart disease data set, which is one of the most popular on UCI repository. And for the evaluation criteria, we check the data utility and classification performance for the original data and data with anonymization. And we also check the metrics in K anonymity, L diversity, and T closeness for the privacy. For classification performance, we compared the learning result for the original data, anonymized data without considering the diversity constraint, and anonymized data with our method. And the results showed that the classification performance is more or less the degradation is not considerable, and it is acceptable due to utility privacy trade-off. And because we improve the privacy, as we can see here, these are the metrics for L diversity and T closeness privacy models that we can see in our approach. By our approach, the result for preserving the privacy with respect to attribute linkage attack was improved. And these figures show the privacy utility trade-off. We can see that by increasing K, which improves the privacy, we have a decrease in the classification performance. And in conclusion, we proposed a anonymization method based on constraint programming and clustering, which we consider k-anonymity, L-diversity, and T-closeness together. And the evaluation result shows that our approach can still have acceptable data utility while providing better privacy with respect to attribute linkage attack and record linkage attacks. Thank you for your attention.